Cooper. Welcome to Front Porch Conversation. I am so excited that you're here with me today.
I'm glad to be here as well. Thank you for inviting me.
Oh my gosh. Okay, I'm just going to be like a kid in a candy store because you're my favorite person outside of, who, right?
Yes, yes,
You
yes.
are, I love you so much, and that you came all this way to have a conversation with me means the world to me.
Well, I can't tell you how much I appreciate your hospitality, and it's always a pleasure to talk with you, always.
Well, thank you. So let's just jump straight in. I want
Okay.
to talk to you about self care. And I want to talk to you about self care from the perspective of you care for everyone else and you teach them how to care for themselves. But I know you as this woman who is in demand from people, dignitaries, law enforcement officials from around the world. And you answer the call because there's not a lot of forensic developmental pediatricians who've been doing exceptionally excellent work for 40 plus years. How do you find time? How do you make time to care for yourself? And explain self-care to me for you versus how you explain it to your patients, or is that the same?
No, it's not the same. With my patients, I try to encourage the relationship between the children and the parents to become richer and definitely more nurturing. One of the things that I noticed, of course, is because my children have developmental disorders, for example, my children who have autism spectrum disorder, the parent has to have realistic expectations of the child, and it isn't uncommon that I have to normalize the child's behavior and let the parent understand that, that's really super common. Oh, your child has insomnia and isn't going to sleep until midnight every night. We do see that really often. And so let me give you some medicine that's not a narcotic or anything of that nature that will help your child to sleep so you can get some sleep, because then I know you can be a better parent to your child. And the parent is always very appreciative in that situation. So I like to try to nurture the parent so that the parent can nurture the child.
And in turn, that is self-care for that parent.
Absolutely.
Because their time is really valuable, because often their children, if they're not sleeping, they're going 24/7.
That is correct. And very often, especially parents of children who have developmental disabilities, very often it's a thankless job. It's ever present, and oftentimes when they come to the doctor's office, they expect only a prescription or some kind of documentation to give to a school system or a new referral someplace. But what helps me for self-care is to nurture a parent, because then I feel as if I'm not just helping my patient, the child, I'm helping that dyad. And that gives you a really good feeling. Sometimes you can't always be successful in that, but when you do, you can sit back in your chair afterwards and you can breathe a sigh of relief and have some herbal tea before your next patient and say, that was a good one. That one worked out really
Well, see, I understand that from your perspective because I know how you are and the way you serve. But I want to drill down. How do you personally practice self-care when you go home and when you're not too tired? How do you practice self-care? And I'm not talking the bubble baths. What is that thing you do to relieve all the secondhand trauma and the vicarious trauma that you have witnessed, been a part of? How do you not keep it with you in your being?
That's a really good question. And I feel that when you have to work around crime and punishment scenarios, and especially when you see suffering of children and suffering of victims, you first and foremost have to separate yourself from that, both physically, and at a certain point you have to give yourself time to be away from it, because if you don't, it pervades your brain and your thoughts, and you will constantly worry about some given patient or some given circumstance. You may take on the, why did that case not go well? Surely I could have done more to have made it have a different outcome. So the first thing that I try to do is to recognize that I am not the great I am not the great creator in the world. I have to recognize my humanity. I have a motto, and that is, let me just be part of the solution, not part of the problem. That's a cognitive approach. But from a other type of approach, I'm very spiritual. And so very often, if I have been exposed to things that are pretty traumatic and could be very show-stopping, so to speak, for me or anybody else in that manner, I will decompress when I come home. I often do that by playing the piano, very often. And I'll play all kinds of music, but I do usually play Christian music or spirituals because they are very timely in moments like that. A second thing that I do that is very helpful to me is to cook. And the preparation of cooking is very helpful because I'm on a plant-based diet and you have to do a lot of chopping and having things that are fresh,
Yes.
etc. And in the process of doing that, that's very relieving. It gives you a place where your eyes, your ears, your smell, all your senses are devoted to something away from what you were thinking about. And then I think I have pets, and I understand now. I very much understand the role of emotional support animals. My pets are not trained emotional support animals, but I find that having a pet is very extremely soothing because you come home and you're going to be caring for an animal that needs your care, but also who cares back to you. And that's also extremely helpful, especially when you can talk to that pet and just say, I can't believe that that happened and this and that. They don't talk back and criticize
I was about
you.
to ask that question.
They always listen.
Okay.
Right, right. So in that sense,
Well, I'm
I
going
would
to tell you,
say
I would
that.
talk back for the animal. I would ask the question, then I would answer like, this is what you really want to say back to me. Okay, I don't know if I need some help, but yes.
No. I often say, well, I'm glad to know I'm not schizophrenic. Okay,
Yes,
we'll
right,
get it
right.
here. Right. I do yoga, and I usually do a very specific type of yoga because there are many types, but I use Kripalu meditational yoga, which is a very slow type of yoga and very therapeutic, entails a lot of breathing, and it entails the practice of being able to clear your mind. That is a very important thing to be able to do, and I actually had to go to yoga classes in order to learn how to do that. But once you have cleared your mind, then things are better. When you finish your yoga, you get up feeling revived. It's very different from aerobics, where you're really doing a lot of active exercise. Meditational yoga is quite different as far as that's concerned. I also try to not junk up my mind with too much information that's not going to be helpful to me. So I used to be a fairly avid television watcher, but I stopped several years ago because there was a lot of crime on TV, and whether it was in the news or whether it was drama, but I already am in that space.
Yes.
So I don't really need to be part of watching that even more. I need to allow my brain to have time out as far as that's concerned.
Still, I'm going to tell you something. I came to visit you once, and after I parked my car, I was walking up to the door, and I heard this most beautiful sound coming from your front room. And I just found myself a place on your porch, and I sat there, and I just listened to you play. You're classically trained, aren't you?
I am, yes.
And I thought, oh gosh, I got a front row seat to a private concert by a classically trained pianist. And I was like, look at me, front row seat right here on the front porch. I thought it was I was there for like 15 minutes. And then I knocked on your door and you were like, how long you been here? I was like, how many songs? I think that was 3. It was so beautiful. And so I know it must really revive your spirit, because for me to sit on the porch and just to listen, it calmed my breathing down.
Yes.
It just allowed me to just be in the moment.
I would have to agree that I'm very grateful that I learned how to play the piano. And then, ironically, when I turned 12, my music teacher said, I want you to start playing the organ and learning how to play the organ for our church. So I first started learning how to play the organ for church when I was 12, and I still continue to play the organ for my church now. And that requires practicing on the piano at home. But when you go to the church to practice, it's a little bit more complicated, but it's a good thing because it definitely gives you a sense of well-being when you are able to participate and support choirs and soloists and things of that nature. That's a different kind of giving. The other thing that is very helpful for me is teaching children. And I have taught children in Sunday school for 34 years. And that is...
I want to say that's my age, but that would be a lie. But yes, 34 years. Oh
that,
my goodness.
Yeah, that is, and I really appreciate that because you are reading the Bible in the process of getting ready for that, and then you have to animate it from your voice when you're dealing with young children. And I usually teach 3rd and 4th graders, a few 5th graders. So that's a degree of elementary learning that's just right for me as a pediatrician. Just right.
So, you know what I was thinking about? When I start thinking about you, I know you as retired full bird Colonel Sharon W. Cooper. I know you as Dr. Sharon W. Cooper. I love the W, by the way. I have to say it. Dr. Sharon W. Cooper. I know you as that person. I know you as a forensic developmental pediatrician. I know you as a mother. I know you as a friend. I know you as a giver. I know you as a person that the community, and when I say community, I'm talking about the global community as well as your local community, will call whenever there's high profile cases that requires someone with your expertise. And I know you as a thought leader, and I know you as a very thoughtful person. And so knowing all of those things about you, I mean, one person with one of those things for a lifetime would be enough. Can I just say that? But all of that, you have decided to take on another role. And maybe it's a role is not the correct way to describe it, but to add another component to who you are. And that's with the establishment of your nonprofit. Tell me what brought you to that place after I just sort of listed some of the things I know about you. What brought you to wanting to give in a different way, serve in a different way, teach in a different way, enable people to reach their full potential perhaps in another way? Talk to us about that nonprofit, and what's the name of the nonprofit?
Right. The name of the nonprofit is the MACE Foundation, which stands for Maternal Adverse Childhood Experiences. And the reason that I wanted to begin working in that area is because as a pediatrician, I see children almost exclusively, not 100%, but almost exclusively as a dyad between mother and child. And I've seen so many young women who have had a lot of adversities in their lives, who turn to parenthood often unprepared to become a parent, or may have become a parent because they've been a victim of a crime, or may have become a parent because they want someone to love them, as compared to their being willing and yet and able to love that child. And when I think about those kinds of dynamics and the nature of the numerous patients I've seen who have had adversities in childhood, I recognize that we weren't paying attention to that dynamic. We are paying attention to adverse childhood experiences because we want to make sure we can be on an active surveillance for hidden autoimmune disorders, and we want to try to make sure that there are opportunities for survivors of various types of crimes to have appropriate mental health support and community support. But we haven't focused specifically on women, and we haven't focused on women of color. We haven't focused on women who were juveniles when they were so profoundly abused and neglected. And I felt that that was an empty space we weren't paying attention to. I also felt that my colleagues in obstetrics were not knowledgeable about the issue of adverse childhood experiences. They tend to see pregnant women for that window of time, and they do try to screen for anxiety at least in the course of obstetrical management. However, when you have a patient who's had trauma and has PTSD and has anxiety and has depression because of adversity as a child, you as a clinician need to be thinking, I need to meet some more needs here. And I've just not seen that either in the literature nor have I seen it in practice. So I felt that the time had come, because of my experience of watching children with multiple adversities over so many years, who I knew were going to grow up and some of them were going to become mothers. I just felt the time had come that we needed to prioritize that very particular population so that we can inform them of the fact that they've had adversities. Many survivors believe that this was just the way life was supposed to be for them. And they sometimes believe everybody has had lives like this. So therefore they tolerate maltreatment from boyfriends and sometimes spouses. They feel that's all they deserve because they've been treated badly growing up. So it's not a woman empowerment dynamic. My concern is, in addition to our addressing your mental health problems, we need to be surveying you very carefully for physical health problems, and we need to understand the concept of spiritual wounding. Because when a victim has been a victim, and no one has acknowledged that, no one has ever said, I'm so sorry this happened to you. And no one has ever empowered that survivor by saying, what is it about you that has made you make it so far? We don't give that message. And so I felt that it was time for us to pay attention to adversities in women who are considering getting pregnant and women who are pregnant. And of course, there's that part in my heart about active duty service members, because I have seen many active duty service members over my career. And when they start to become mothers and are pregnant, many times the PTSD that they may already have had becomes much more flagrant for them. And I believe that that particular patient population is going to, on a day-to-day basis, be at higher risk for trauma. We need to be devoting really very specialized services to them so that their obstetrical management will be mindful of the whole issue of childhood adversities and how this can cause them to have much worse anxiety, much worse PTSD, much worse depression. And then if we aren't careful, we'll just say, congratulations, you've had your baby, and now you have a mother who is postpartum, who's dealing with pre-existing depression, and now they have postpartum depression.
And we're expecting her to come back to work immediately, because I remember my soldiers when they were pregnant, and I'm this is just truth. I'm like, okay, how long are you going to be out? Because 6 weeks is a long time.
Exactly.
And we're not going to backfill your job, and we need you. And I'm just telling you how I operated from that space, because I have a mission to accomplish, and I have to have my soldiers at the ready. I would say that I'm embarrassed, but I tell the truth about myself all the time.
Yes, you
so
do.
It's just truth, and we're not going to be embarrassed here. But as a military officer, having troops and having female soldiers under my command, I was not sensitive to any of what you just spoke about. Mm-hmm. And if I tell the truth, which I'm going to do, I would often catch myself saying, is this her second child in less than a year? Is she ever going to do any work? To hear myself to even say that here some 35 years later, it just gets me here that I would even think that and never thought about any of the things you talked about. That's disturbing to me. It's true, but it's disturbing to me. And after the soldier giving birth, I wanted them back in that space as quickly as possible.
Your attitude is still prevalent. The one that you described.
The attitude that I used to have.
That's correct. That's
yes.
right. We still hear that from commanders and from all the way up the chain of command, from the most junior person who has some supervisory control over a younger service member to very high levels.
But let me say this, but I didn't say that for my male soldiers. If they had a problem drinking or with drugs, let's send them to get help so that they can come back ready and ready to perform. I did not say that about a female soldier who was going to bring a life into this world.
That is correct. And it's interesting that you mentioned that. That's very important because in the military we still have problems with sexual assault and a lack of empathy a lack of understanding, a lack of what being sexually assaulted as a service member can do to an individual. They may not be able to work the way that they had worked before up to the same level, and we don't often or enough try to accommodate that kind of trauma.
So, are you going to, through the Mace Foundation, have a special perhaps program or any type of research done in this space so that we can address these issues and the attitude that I used to display some 35 years ago? Because I can see the harm that I caused, not only probably with my words, but with the way I looked at the soldier, not thinking about pre-existing adversities that they could have gone through as a young person, or even if they were teenagers, 18 and 19. Never thought about those things.
Yes, and to answer your question, not only am I mindful and I try to teach residents and colleagues about how to have empathy for our patients, mothers, the other piece of it is that if a service member tells me in their medical history that they had been a victim of sexual assault, and how that comes out is that I will say, and so have you had any service related, I usually don't start with service related. I will say, have you had any other problems? And they may say, well, I have PTSD. My next question will be, is that service related? Because it could have had a helicopter crash. There are many things that could happen, right? But when I have service members that say, I was sexually assaulted, I used to say, I'm very sorry that that happened to you. I always still do say that. But I didn't ask the next question, which we should all be asking when we're talking to service members. And that is, and is this why you are medically retired? And is this why you are no longer on active duty? Some service members medically retire, some service members are put out of the Army. And if they say, no, I separated from the Army, then I didn't know in the past, but I do now, to ask the question, and were you satisfied with the level of your discharge?
Very important question.
Exceedingly so, because we are finding that sexual assault victims are many times discharged from the military under less than honorable conditions. And service members who experience a sexual assault, especially when the assault comes from within the ranks, I see that as insult to injury. You're already injured, and it's your own battle buddy, so to speak, who has caused that injury for you. We as a system should never punish that service member. When the service member says, I want to get out, I can't take it anymore, we should say, you are a wounded warrior. That is basically what has happened, because they were in a circumstance.
Oh, without question, without question. Those are the kind of conversations that are uncomfortable for many. But it's the kind of conversation that we have to have and bring to the light here. I also understand it's not just impacting them getting out with the less than honorable discharge and with a stigma attached to them, but their VA benefits.
That's
Those
right.
things can go away. I mean,
that's a huge,
oh my goodness,
huge
that's punishment.
injustice. Yes, it is. That is exactly right.
For reporting, perhaps, that sexual assault
has occurred.
Yes, that it has occurred, and now I'm going to ensure that you are discharged under less than honorable conditions. Now you're impacting benefits for me, whether I can get a VA loan, because everyone wants to know under what circumstance were you discharged. So I'm glad the Mace Foundation is going to be looking at this and bringing awareness and education and training to those in leadership positions, but also to those who are serving, so that they understand more about themselves,
right?
What has happened to them, and that they are more than what has happened to them in a particular time, but there are services available for you to address those issues. I'm thankful that you're going to allow them to be empowered by new knowledge.
Yes.
So they can care for themselves.
Right. And I'm very hopeful that not only are we going to be addressing the medical implications and the psychological implications, but the Mace Foundation is going to be working with law schools that work on the expungement of records of veteran women and women who have been discharged specifically because they were sexually assaulted and had less than honorable discharges. That's another role that Mace is going to play, to provide training to these attorneys who will represent veteran women so that they can get their VA benefits.
Thank you. Long time coming, way overdue. As a former active duty service member, as a veteran of two branches, and the women that I hear from today, and knowing that I was a part of the problem 35 years ago is because I never thought about it. And so being a female did not automatically make me think about those things. And so I think it's important that we are all trained.
Absolutely. One of the things that I try to teach residents whenever I am working with them in my clinic, regardless of, and remember, I'm usually seeing their children, the children of veteran women and other women, but when I'm talking to veteran women and men as well, always I try to teach residents to extend a salutation of honor to that soldier, no matter where they are, whether they are a VA beneficiary, whether or not they were put out of the Army for whatever reason they were. I always say thank you for your service. I always do.
And you mean it.
I do.
It's something different when it's empty. You know, people see my military bag because I wear it everywhere I go, right? I'm so proud of my bag and my service. And that was the thing that women, quite often when they were speaking about their military service, they would never refer to themselves as veterans. And we just had a really huge conference here in Texas about that. And I was appalled. I'm like, I've always said, yeah, I was active and I'm a veteran. And they were like, no, we don't tell people. And I didn't understand that. It was so much beneath that.
Yes.
It's some of what we're talking about today. And they were feeling shame for the way they were put out or had to leave the service and all of those things. So it's critically important, the work that MACE Foundation is going to do. I want to shift a little bit, but stay on MACE because I understand that you're also going to have fellows.
Yes.
MACE Fellows as a part of your foundation?
Yes.
Why did you decide to have that component?
Because if you're going to make a difference, you have to have a diaspora. There has to be a spreading of the message. One small nonprofit organization is not going to be able to, even with the role of the internet and all of the contacts that one may have, the real rule of thumb, if you want to make a difference, is to see one, do one, teach one.
There's nothing more to say on that one. That is absolutely correct. I want to talk a little bit as we're getting ready to close out this wonderful time. I mean, like, we're just sitting here having the best. Okay, before my last question, look at these plants. Are they like gorgeous?
And you did them.
Yes, self-care.
Yes, that's right.
Right.
That's wonderful. Gardening is a wonderful
This is where I do my
area.
self-care.
Yes.
See, gardening and horticulture, because we
Right.
know we taught that to our girls.
Right.
The ones we had in our safe refuge, how to care for themselves through art therapy, music therapy, horticulture therapy,
Yes,
right?
yes,
At
right.
first they were like, playing in the dirt, Miss Williams.
Yes.
Seriously, Miss Williams. I said, get to that dirt, I'm gonna get down. But I got down beside them.
Yes,
And
right.
so that thing that I taught my girls has really helped me as well. So we have plants, but we have some vegetables and eggplant and okra
Right.
back there, watermelon
Right.
and,
Oh, that's
and oh my goodness,
wonderful.
squash. Playing in the dirt for me helps to relieve stress.
Yes.
And allow me just not to think about the things that I would normally think about or all the hurt that's happening in the world and the
Yes.
harm that is being done. So this is a great place for us to have a conversation, for us to talk about healing and hope and the future and where do we go next. So you know I'm in love with plants and gardening and healthy eating and walking. Are any of those things ever prescribed to your patients as a way of healing?
Absolutely. I say this to, if I see a survivor who's 10 years out, I say the exact same thing that I say to a survivor who might be 2 weeks out. And that is, we need to help you get into a place of wellness. We want you to be in a place where you don't feel afraid and where you don't feel threatened. And one of the best places that you can be is out in nature. I encourage hiking, not hard hiking, but hiking in unstructured parks, not where there's a lot of equipment and things of that nature, but safe
Certainly.
tracks, etc. And not only do I recommend that to my forensic population survivors, but I also recommend that to my parents and families because it's very helpful, it's very soothing, it's very healing to just be able to go outside and look at the sky and
yes.
just, breathe the air and think good thoughts. And there's so much research on that. and how that helps to alleviate anxiety and diminish some of the feelings of self-deprecation. It's just so wonderful in that sense. So I so applaud you for using that as a method in your own life, and it's certainly one of the ones that I do too.
Amen to that. It changed my life.
Yes.
When I got out the military, I said, okay, no more running ever. No more 8-mile runs that I was struggling through then. No more getting up at 5 o'clock in the morning doing PT, physical training. No more of that. I'm just going to refrain from all of it. Wrong thing to do. Wrong thing
Right.
to do.
Right.
But I have picked back up, and it has been the best gift that I could have ever given to myself.
Right.
And so as we get ready to close, and I hate to close, there's so many more things I want to talk to you about. Okay, first of all, let me just say I love you so much. And this is such a treat and it's such a gift sharing this moment with you, realizing that all we have is this moment, that tomorrow is not promised to us,
That's right.
and that when I look to you for guidance and wisdom, because you know you are my shero,
You're so sweet.
yes, and my sister in this fight that we've taken on, and in the desire to help heal wherever we can. You have just blessed me so much for being available and also telling me when I should not be available to people. Thank you for that, because it has given me moments to really reflect on who I am and what I need to be doing with my life. And when a person speaks truth to you in such a loving fashion, you learn to love yourself even more in that same way. So I know how you demonstrate that for me. So I can only imagine that your patients feel like I do about you, but I'm going to say my love for you is stronger. Just a little biased. But I so thank you for the role that you play. And I'm just really, really thankful that you do take time out for yourself to practice self-care. And it's not about, you're a practitioner of self-care. So you don't practice it one day, and you are truly a practitioner, and you have set an example for me. And I thank you for that, and I thank you for coming this long way to have a conversation on the front porch or on the back porch. And I hope we get to do this soon. But if not, this time, this moment where we are together today, it has been so enjoyable. And I so appreciate you for saying yes.
I just have to say thank you so much for inviting me, and I have to give credit and honor to you because it was you who helped me to understand that taking a different dietary route to wellness was going to change my life, and it most assuredly has, and it has caused me to become the new bell ringer, if you will, to all of my patients' families. I will say, your child with autism doesn't eat vegetables. Let's talk about all the different things that he can eat that look like they're meat, but they're really vegetables. And I spend a lot of time every day talking to my patients, and I give them all the reasons why having a plant-based diet is a healthier diet and what we want to do for our children and their parents and their families. So I thank you for giving me that guidance, because it's very, very good guidance, very healthy, and another part of wellness.
It is, for sure. Well, thank you for sharing this time with me on Front Porch Conversations.
My privilege.
You are my friend, my shero, and I love you dearly.
And I love you too.
Thank you.
Take care.